So, just a bit of an overview. I'm sure many of you are familiar with this, but in terms of MDS and how it originates, which is really important, and if you think about treating bone marrow and blood cancers, understanding the biology is absolutely critical to really being able to manage symptoms and long-term outcomes really well. So, we all start off with relatively normal bone marrow cells. Then, over time, it's very normal for our DNA to change and for what we call mutations to develop. And some of these specific mutations can cause an advantage in some of these abnormal bone marrow stem cells, and this is what causes MDS. Further changes in the DNA or other mutations can also develop over time, and this is why a proportion of patients who have MDS go on to develop acute myeloid leukemia. Now, there's a huge focus on transformation of MDS to AML, understandably, but actually, the majority of patients with MDS don't develop acute myeloid leukemia. The majority of patients with MDS actually suffer from anemia. So, at some point in their sort of MDS journey, the vast majority of patients, over 80%, will be anemic. And around 50% of those anemic patients at some point will become dependent on red blood cell transfusions, which I'm sure many of you will know a lot about. Now, in terms of talking to patients, which we've done a lot of over the years, here in Oxford and via MDS UK, we set up a programme looking at what matters really to patients with MDS. And of course, people are very interested in long-term outcomes and the possible development of AML. But actually, one of the key features that came out of this workshop was actually managing anemia and managing fatigue. So this is something we've now really focused on. So how do we currently manage anemia in patients with MDS? So in the UK, treatment is relatively limited at the moment. So we typically call it supportive care. So supporting your bone marrow's production of blood cells. And this in the area of anemia is really dependent on transfusions and particular growth factors to actually stimulate your bone marrow to produce more healthy blood cells. And this is a growth factor typically that we call ESA, erythropoietin stimulating agents, or EPO, you might know it as. And that's really where we are and where we have been for many years in terms of the treatment pathways for patients with MDS. Some of you may know that over the last few years, there's been real excitement in the field of anemia and MDS, with two new drugs, luspatercept and imetelstat, being licensed by the FDA in the US and other similar organisations in Europe to enable patients to be treated with these drugs with certain types of MDS. Now, unfortunately, these are not available in the UK, which is why it's extremely important that we keep looking for additional treatments for anemia and MDS. And the way to do this is to develop a clinical trial or a study looking at what is better than transfusions and growth factors in the long term in terms of new drugs that we might be able to develop. So I'm now going to hand over to Kevin, who's going to tell you about the science that he's pioneered over the last few years, looking into vitamin B5 and how it might help anemia in MDS. Thanks, Kevin.
So over time, your normal hematopoietic system, so your blood system, is going to acquire mutations. And among these mutations, there is this mutation in SS3B1. SS3B1 is the splicing factor. So to modify your RNA and generate proteins, which are the units which are functional in our cells, in our body, we need to modify them. And SS3B1 is one of these proteins that modify these units. Unfortunately, when it's mutated, it's going to create a mess and is modifying a lot of proteins, and all these proteins are potentially affected. And this is what we call aberrant splicing. And the problem with this aberrant splicing is that we don't know where to look because there are thousands of proteins which are affected. So about 2 years ago, we actually showed that one of these proteins which is affected is an enzyme which is called COSY. Just to make it simple, an enzyme here is something that is going to process different nutrients, for example. And in this specific case, this is an enzyme that processes vitamin B5. So once COSY processes vitamin B5, what's happening is that you are going to generate hemoglobin, and that will allow you to generate red blood cells. So when you have a healthy blood system, your enzyme is capturing vitamin B5, and you generate hemoglobin, and you generate red blood cells. When you have SS3B1 mutations, these enzyme numbers are reduced, and you see less hemoglobin generated. And because you have less hemoglobin generated, you have less red blood cells. What we propose here and what we showed in vitro, so in our petri dish with patient cells, but in vitro, is that so you can see that the number of Pac-Man are reduced, and that's what actually is happening in patients which have SS3B1 mutations. What we propose is that for these Pac-Man which are still present, they are still functional. So we can saturate the system by adding more of the substrate, which is vitamin B5. And when we did that in vitro in our petri dish, what we saw is that we can enhance back the production of red blood cells. And so that's the basis and the fundamental for the research and the clinical trial development that we would like to put forward. Oni, I'll give you back the hand.
Thanks, Kevin. As Kevin's explained, we're sort of working in collaboration together to build this science into a clinical study, which we hope could benefit patients with MDS and anemia. So the core team really is obviously myself as the chief investigator of the study, with Kevin as the chief co-investigator and the scientific lead, and Dr. Shoshana Burke is one of Kevin's PhD students who's also working very closely with the study. Now, we couldn't do this without MDS UK's support and your support, of course, as the patients right from the beginning. That's really critical. So thank you so much for joining the call and being so interested in the work that we're doing. And beyond that, we've also progressed to the stage where when you develop a clinical study using a new drug or even repurposing a drug or a vitamin that's already out there, you need a sponsor for the study. And the sponsor for this study will be the University of Birmingham, who've accepted sort of this exciting proposal and are taking this forward with us as a clinical trial proposal. So it's very much at the stage where we're developing the proposal to make it useful for patients in the longer term. Now, we also need other collaborators. We have UK collaborators and advisors who've got a lot of experience in terms of developing clinical trials, and actually in Europe as well. People are extremely keen and excited by the work that we've been doing. So in terms of vitamin B5, just a bit of an overview, as obviously we often hear a bit more, I guess, about B12 and other B vitamins. So it's a tablet, which makes it very attractive in terms of a medicine. Very few side effects have been detected so far, some sort of gut diarrhea type side effects at certain doses, but it's been generally very well tolerated from what we have seen so far in other studies outside of MDS. It's known to lower cholesterol, which obviously could be beneficial, and it can help with skin conditions, particularly acne. It is actually quite ubiquitous, so you find it in many different foods, but in relatively small amounts. So our aim is to really boost the amount of vitamin B5 that patients with MDS and anemia, SF3B1 anemia, are receiving. So in terms of a timeline for this, so this really is where we are at the moment. So the trial is being developed by the University of Birmingham Clinical Trials Unit. We are planning to submit applications for funding, which is an absolutely vital step in developing any form of research, particularly a clinical trial, to make sure we have all the funding in place to enable the trial to progress. And the first funding applications are due to go in this sort of spring, summer, but these pathways are long and often funding isn't received the first time you ask for it. So there's a very iterative process in terms of developing these applications, which it would be great to have as many patients involved with as possible, as that really helps the applications. So in the autumn, winter of this year, we'll find out about applications for funding from these first two initial applications. And then only really if those applications are successful. And again, to reiterate, it's rare that applications are successful the first time round. Um, we would potentially receive approval to move forward in early 2026. And so the trial, which we think would probably take around 3 years to run, would probably be running from 2027 to 2030. That's just to give you some idea, and happy to talk about that more. In terms of what the sort of trial that we're designing at the moment might look like from a very sort of simple diagram. So currently we're calling it B5 for MDS, and it's a prospective, so that's looking forward rather than looking at back at patient data. Phase 2, so it's a a drug or a vitamin product that has been utilized before, so we're just trying it in a new setting. It's a phase 2 trial of oral vitamin B5 to assess improvement of anemia in patients with myelodysplastic neoplasms, or to be more precise, a specific type of myelodysplastic neoplasm where patients have this genetic change in SF3B1, as there's really good biology to support that, particularly in those patients, this might be beneficial. So the current designers will be adult patients. Obviously, the majority of patients with MDS are adults. Patients will need to have a documented SF3B1 mutation and also be anemic. You can have an SF3B1 mutation and be sort of what we call higher risk MDS, and we're really focusing on the lower risk MDS patients. So if you're familiar with the IPSSR or the newer IPSSM scores, that's sort of what we'd be looking at as well. There will be a variety of centres involved because MDS is still relatively rare as far as for a clinical trial recruitment goes. And those centres aren't, it's not clear yet where those centres will be, but there will be multiple UK centres. And although a huge amount of work and this trial is big in one sense, when you start off with these studies, you always do it on a small number of patients when you're looking at whether it's effective and whether there are any side effects. And so this would be about probably around 30 patients, but that's to be decided. And then the aim would be to be able to prove that vitamin B5 is useful and then move it along quickly to a bigger study where ideally it would be what we call randomized. So and we'd be able to see whether vitamin B5 is better than an alternative or better than nothing at all. This study is really just vitamin B5 effectiveness. So everyone on the study, just say it's around 30 patients, would receive a high dose of vitamin B5. We've talked about the opportunity to bring that dose down if needs be, if for some reason patients had some side effects that mean that reducing the dose might be helpful, still enabling them to get benefit from the vitamin B5 rather than suffering from side effects. And then we would probably give the vitamin B5 for at least 24 weeks, so that's 6 months really, and look for an improvement in hemoglobin, look for a reduction in the needs for transfusion in patients who were on transfusions, but you wouldn't need to be on transfusions to be part of this study. And also importantly, look at symptoms that patients are experiencing and their quality of life. And although we're not expecting many side effects, part of this assessment will also be to look at side effects and safety, of course, and that's paramount, and also to be able to have a look at the dosing of vitamin B5 to check we've got that right before moving to a much bigger study if we can show it's effective in this first study. And as I've said, it would probably be over a couple of years that we would recruit patients, and then we'd follow up everyone for an additional year after, so probably 3 years of follow-up in total. Now, so far in terms of funding, MDS UK have been absolutely fantastic. They provided us with a really phenomenal amount of money to progress with some of the work that Kevin and Shoshi are doing, to develop some assays, as they said on the website, to look at how vitamin B5 might benefit patients. Well, let Kevin talk about that a bit more, and we can come back to this slide if that's helpful later on to discuss a bit more about the study, albeit at the very early stage. Thanks, Kevin.
Thank you, Annie. Just a few words here is to so the vitamin B5 is exactly what Oni said, is funded by the MDS UK support, and it will help us to understand the biology of vitamin B5. So, for example, how fast is it cleared? Can we measure it? Are we making sure that if you take it in the morning, you still have some left in the evening? So these kind of questions. And then once the clinical trial is funded, we want to leverage this funding to understand better the disease and understand how vitamin B5 is going to affect the biology of MDS to then come back and inform back the clinical trial and the guiding potentially management of the patients. So I won't say more words on the science part that we will do, but if you have any question, please jump in. Thank you.
Great, thanks, Kevin. So I think that's it from us in terms of a presentation. I hope that was helpful. We're very happy to take questions, but I'll let Debbie chair the rest of the meeting so it doesn't get chaotic with me doing it.